Hi, my name is Meral Beksac. I'm from Ankara University, Department of Hematology. And today I'll be talking to you about our poster that we presented to the European Myeloma Network, the second meeting, which is taking place now currently. And we are very happy and we would like to thank the organizers for selecting this poster as under 40, the best abstract. I'm going to be presenting you on behalf of my co-authors, Ekin and Güldane, who are our fellows who contributed to the preparation of this data. And the topic is about COVID infection outcome during lenalidomide maintenance. A year ago, when the pandemic broke out, we were at a position of uncertainties because we didn't know how to approach our myeloma patients during a pandemic, which was spreading around very fastly, and patients were severely impaired. And there were recommendations appearing during the course of the pandemic, and the recommendations suggested that we should continue myeloma treatment because myeloma was more dangerous than the COVID itself. However, drugs such as lenalidomide has consequences of impairing the normal B lymphocyte function, which is ending up with lymphocytopenia and immunoparesis. So for this reason, we decided to analyze our data retrospectively. And so far during this last year, and especially during the last couple of months, we have come to observe COVID infection among our myeloma population. And we have gathered data on 48 myeloma patients who have experienced COVID infection. And during the course of these patients, some of these patients were already on lenalidomide maintenance, and some had discontinued lenalidomide maintenance. So this proved to be a good comparator. And I would like to summarize our data on 23 patients who were on lenalidomide maintenance and who experienced COVID versus 25 patients who also experienced COVID but were not on maintenance. The baseline characteristics of these two groups of patients were similar, and patients on lenalidomide, their myeloma status were similar to the ones who are not on lenalidomide maintenance. However, the lymphocyte counts in the patients on lenalidomide were lower than those who were off lenalidomide. And likewise, lymphocyte counts were similar, and immunoparesis was also similarly more impaired among patients who had lenalidomide maintenance. As a comparator, we also selected 21 additional patients who were on lenalidomide but did not experience any COVID infection. This was used as a comparison for their lymphocyte neutrophil and immunoparesis status. Regarding the severity of the COVID infection, I think this is of particular importance. Patients who are on lenalidomide and who experience COVID, the severe COVID infection rate was 26%, whereas in those patients who were not on lenalidomide but had COVID infection, that rate was 44%. And the infection fatality rate was also higher among patients who were not on lenalidomide, and most of these patients were coming from the severe COVID infection, and the infection fatality rate was 48%. So in comparison, and as a result, we can say that patients who are not on lenalidomide, their COVID infection severity and fatality rate is higher than those who are on lenalidomide treatment. And from this, we can conclude that based on our experience, there is no need to stop lenalidomide treatment when a pandemic such as the COVID one is ongoing, since it doesn't predispose patients to more severe disease, there are additional factors that should be taken into account when considering infection severity and the outcome. And of course, we need to emphasize the importance of stopping treatment when infection occurs and when it is diagnosed, and additional measures to improve the cell counts, and also immunoglobulin supplementation could be needed to manage these patients in a better fashion and without any fatality. With this, I would like to conclude and thank you so much for giving this opportunity.